All right, we're going to go ahead and get started. Thank you so much for joining us. I've said this a couple times, but for those of you who just joined us, this meeting is being recorded. So we're going to have a Q&A session at the end of the presentation. And if you have any questions that could be sensitive to a provider, a site, or a community, and you don't want it put out to the whole world, please do feel free to email us and we'd be happy to answer your questions. So my name is Bill Funder. I'm the Incentives Program Manager at the Oregon Office of Rural Health, and I'm presenting today with Trixie. I think you're muted, Trixie.
Hello, everybody. Happy to be here today. Thank you for joining us.
Awesome. Yeah, Trixie is our Recruitment Retention Manager, and we are both on the Workforce Services team over at the Oregon Office of Rural Health. And on our team, but not presenting today, we have Rachel Bergerath, Joey Lawson, and Brittany Johnston. We have an amazing team. It's likely that a lot of you have interacted with some part of the Workforce Services team. I couldn't be prouder of the work that we do. And today we're going to be going over addressing workforce shortages in rural Oregon. And we're going to be doing a lot of that through the lens of the programs and services that we offer at the Oregon Office of Rural Health. So who are we? We're the Oregon Office of Rural Health. We are the state Office of Rural Health. Every state has an Office of Rural Health, and we're Oregons. And we were created by the Oregon legislature in 1979. And there for a while, the Oregon Office of Rural Health had its own offices. Sometime in the 80s, mid 80s-ish, there were some budget issues. So some of the state offices ended up not being absorbed by OHSU, but being housed at OHSU because as a public institution, and even back in the 80s, OHSU was even more of a public institution, it made sense to consolidate some offices to save some money. So while we have at OHSU email addresses, and a lot of our administrative stuff is coordinated by OHSU, we are not OHSU's Office of Rural Health. We are the State Office of Rural Health housed at OHSU. We do things like collect and disseminate information. And a lot of that information has to do with workforce shortages in Oregon. We have an in-house data analyst named Emerson On. Emerson has been with us for many, many, many years. And he puts out all of our maps, our shortages reports. If you've read the Area of Unmet Healthcare Needs report, he is the person that puts that out. If you haven't read that report or you haven't read it recently, I highly recommend that you go to the Oregon Office of Rural Health's webpage and click on Data and Publications, and you can find all kinds of information about workforce shortages in Oregon, broken out by things like provider type and communities. We have a whole cache of great data that is out there and is used both on the state and federal level for a variety of different reasons. So please check that out. We're very proud of that information. We provide technical assistance. So we have on our side of things, we provide technical assistance to practice sites and providers for recruitment retention, things like provider incentive programs, developing recruitment strategies. We also have a field services team who works with getting clinics set up as rural health clinics, certified rural health clinics, quality assurances. We have a whole lot of programs that I could go on and on about, but we do not have the time. I highly encourage you to check out our website. A lot of good information there on what our various teams provide. We coordinate rural health activities. One of the big ones that's coming up is our 40th annual Rural Health Conference, which is just, it's going to be huge. It's going to be awesome. It's going to be the fair, the fire, 4th of July, all combined into one, but none of the animals and fireworks, just a whole lot of folks getting together and talking about the challenges and successes in rural Oregon. We've got a lot of really great speakers lined up. So I do highly encourage you to check out, again, our website. You can register. It's going to be in Sun River this year at the Sun River Resort. Beautiful area for a great conference. And because it's the 40th, we have a whole lot of really cool stuff going on. And we provide recruitment and support for Oregon's underserved communities. And part of that recruitment support is through the programs that I administer and the services that Trixie offers. So we're going to go into a couple of definitions here. When we talk about provider incentive programs are a tool that can be used to recruit and retain providers to a community and or a clinic. They should be a tool in a much larger toolbox. And Trixie's going to add some information in here to add some more tools to that toolbox and some information. But it really takes more than just the things that we're offering here to address workforce shortages. It really does take effort on the ground. It takes effort on the state level, on the federal level, and it takes buy-in from practice sites and community leaders. To achieve that through provider incentive programs, we partner with state and federal agencies like the Oregon Health Authority. We work very closely with them on many of our programs, and we also work very closely with Health Resources Service Administration, also known as HRSA. HRSA also funds things like the National Health Service Corps and Nurse Corps. So we're going to start out this presentation going over some provider incentives, and then we're going to kick it over to Trixie, who's going to talk about services that she offers. So when thinking about incentive programs, generally there's two main types. There's loan repayment and loan forgiveness. Loan repayment, when I'm talking about loan repayment programs, those are programs for clinicians already working in the field at practice sites who have qualifying medical education debt, and they can apply to loan repayment programs to receive tax-free funds to pay off a portion or all of that qualifying medical education debt in exchange for a service obligation to the state. When I talk about loan forgiveness programs, those programs offer tax-free funds to students enrolled in qualifying programs, and they have a portion or all of their medical education paid off in advance in exchange for a service obligation at an approved site in Oregon once they graduate. If you all have questions, feel free to type them into the chat box, or at the end of the presentation, we may be able to open up microphones with this webinar setup if we'll be able to unmute folks. But generally, the best way to have your question reviewed is by. So one thing that unifies loan repayment and loan forgiveness programs, and to back up just a hair here, when talking about the different terms, loan repayment and loan forgiveness, this is pretty much universal across states and the federal government. So if you hear loan repayment, loan forgiveness, that is kind of a universal definition. Full-time and part-time, there are some federal programs that define full-time and part-time slightly different, and I can kind of touch on that here in just a second. But for the most part, for the majority of the programs out there and the programs that the Office of Rural Health administers, full-time means providing 32 hours per week of direct patient care for a minimum of 45 weeks per service year. So direct patient care hours, that 32 hours, things like patient charting, medication management, consultations, anything that has to do with directly caring for a patient can roll up into those direct patient care hours. Things like clinic administration, clinic advocacy, community advocacy, research, those things cannot count towards 32 that required 32 hours to be considered a full-time provider. Part-time means 16 hours of direct patient care for 45 weeks out of a 52-week service year. And again, that direct patient care thing is the same with part-time. Anything that has to do with direct patient care can be rolled up into those 16 hours, but anything administrative that doesn't have to do with direct patient care cannot. So we have a site application. Our site application was recently turned into a digital form by a member of our workforce services team, Joey Lawson. She did a fantastic job at digitizing it, so it should be a lot easier for folks to complete. It is no longer a fillable PDF, which can be. And a site application is, it's separate from, if you've gone through like a National Health Service Corps certification, if your site is NHSC approved, that doesn't necessarily mean that you're approved for Oregon state level programs. The way to access Oregon state level programs as a practice site is to complete a site application. And they're relatively easy. Most of the practice sites that we speak to report spending anywhere between 15 to 30 minutes on completing a site application, and they are valid for 1 year. And a site application does have to be in place, and the site has to be approved before providers from that site can go about applying to loan repayment programs offered by the state of Oregon. So again, it's a separate program or separate process than being NHSC certified, and being NHSC certified doesn't necessarily mean that you're also Oregon State program qualified, but the application is, it goes pretty darn quick. It's pretty easy. There are no site visits and things like that involved. There are, I'd say, fewer hoops to jump through when completing our site application. We ask for some patient demographics and some assurances that you follow certain policies, and then you sign it, and that's that. So the very first program that we're going to talk about is the Oregon Healthcare Provider Loan Repayment Program. And this is a program that we administer on behalf. I'd like to give a big shout out to the Oregon Health Authority, especially Leah Feist, Jill, I'm blanking on her last name with it, Taylor over at the Oregon Health Authority. They are a wonderful group of people that we work with just about on a daily basis with these programs. All of the provider contracts for these, for the healthcare provider loan repayment program, they are housed with the Oregon Health Authority, but the Office of Rural Health, my office, oversees the day-to-day administration of these programs, of this particular. So eligible provider types. I'm not going to go over each one of these individually. The thing that really unifies this list of provider types, which this provider type unifying thing between all of these provider types is they're going to be licensed, they're going to be in primary care, And they are going to be providing outpatient services. So at the moment, this program does not incentivize those who are providing inpatient services. This is all primary care on an outpatient basis. Site must be located in a health professional shortage area. And notice it says or there. In the past, about a year or two ago, these were all ands and not ors. So this is, oh, someone just mentioned that my audio is cut.
We can't hear you, Bill.
You all hear me now?
Yes.
You can. Okay. Then I am going to completely take off my headphones because my headphone jack just does not seem. Okay. One last test. Can you hear me okay?
Yes.
Mic check.
Yes, I can hear you.
How about now?
Yes.
Okay, great. So I'm gonna, no headphones. Sorry about that, everyone. I'm not gonna start over unless you all want me to. If there was a significant amount of information lost there, give me a shout if
You're still cutting in and out, Bill. Oh no.
wow. Okay, you know what I'm gonna try to do? One, so I was sitting next to a fan. Am I still cutting in and out?
It seems to be good right now.
Okay, so I've moved away from a fan, so I'm going to melt. I am just going to sit here in the unair conditioned, unfanned, but I'm doing it for the greater good of rural Oregon because that's how dedicated I am. And I was using that speech to make sure that my microphone didn't cut out. Was it more stable?
It seems to be stable.
Okay, great. So again, I won't start over unless there's any big objections. So if you missed a fair amount of it, let me know in the chat and I'd be happy to speed through it and go back over it. So healthcare provider loan repayment to qualify, a practice site must be located in a health professional shortage area or have a facility HIPSA, and facility HIPSAs are generally assigned to places like federally qualified health centers and some rural health clinics. And notice where it says or as opposed to and. Are RNs who work in public health qualified? So I'm going to I appreciate you typing that in. I saw it pop up and I read it just to see if it was talking more about my microphone. But that is actually an interesting thing that you put up there that we're going to get into here in just a minute. So I will answer your question, but it's going to be a little bit in the slides and then towards the end. So if you do have questions, please do keep typing them in. So for the Oregon Healthcare Provider Loan Repayment Program, I'm going to say this one more time. The ORs are new. They used to be ANDs. You had to be located within a facility HIPSA or have a facility HIPSA or a geographic HIPSA and be serving Medicaid and or Medicare patients in the same proportion of such patients that exist in the county. Now it's an or. So if you have a HIPSA, but you're not quite meeting those Medicaid and or Medicare percentages, that's okay. You can still qualify because you're in that HIPSA, or the other way around, where if you're seeing the same portion of Medicaid and or Medicare patients that exist in the county, but you're not located in a HIPSA, we can qualify. In fact, there should be another or, oh, in fact, there it is. I did update it in time. The other or is provide essential healthcare services to an underserved population as determined by the authority. And in this case, the authority is those wonderful people that I mentioned at the beginning of the presentation, our partners at the Oregon Health Authority. And essential healthcare services can mean a couple of different things. So that's usually for sites that are not seeing Medicaid and or Medicare patients. Those can include things like VA clinics that typically see TRICARE, or tribal affiliated clinics who have different budgets or don't charge. Free clinics. If you have a clinic who, let's say you're a dental clinic that is not really located in a HIPSA, you're not seeing the Medicaid and the Medicare percentages. Really, it's Medicaid because dentists generally don't take Medicare. But if you're not meeting that percentage, you're not in a HIPSA, but let's say your site sees HIV/AIDS patients, that could be considered providing an essential healthcare service to an underserved population. So there are different paths now to being qualified than just have a HIPSA and are you seeing a relatively high percentage of Medicaid and or Medicare patients. One thing that has remained same and remains is you must have a site application on file with our office and have received confirmation that your site qualifies. Again, site applications are valid for 1 year. So if you're a practice site administrator or if you're a practitioner who is working at a practice site and would like to know if your site is qualified, has an application on file, or when your site applications will expire, please feel free to shoot us an email. We'd be happy to do the research, let you know, and walk you through any questions you have with the site application. So for the Oregon Healthcare Provider Loan Repayment Program, for full-time providers, which again, as we spoke before, full-time is providing 32 hours of direct per week for 45 weeks out of a service year, which is the they must commit to a minimum of a 3-year service obligation in exchange for up to $50,000 per obligation year. So that means that the most a provider can get out of a 3-year service obligation is $150,000, which is up quite a bit. A couple of years ago, it was capped at $35,000 per obligation year for a maximum of $105,000. So that has gone up quite a bit. Another thing that has changed is that those with less than, I think it's 20 blocked here, but if I remember correctly, it's 25,000. Move this. Yep, less than 29,000. So if a full-time provider has less than $29,000 in debt, they could receive up to 100% of their qualifying loans paid off, not to exceed $20,000 for a 3-year service obligation. Another thing that's not in here that I'd like to bring up is that in the past, this program did not consider undergraduate degree debt to be qualifying educational debt. It was all master's level and above. But recently, those rules have changed, and we're allowed to consider undergraduate debt to be qualifying medical education debt. As long as that debt started, from associates all the way up to, say, an MD, as long as we can trace that debt to that MD, we can consider it qualifying educational debt. But even with that, the majority of the providers who top out at that $150,000 max award amount are folks like DMDs, MDs, and DOs. Usually NPs. That's not to say we have had some NPs, DNPs, and even PAs who had a significant amount of debt. Again, it's up to 70% of your qualifying education debt. So your award is based on how much educational debt you have. But generally PAs, nurse practitioners, folks like that usually are somewhere between $40,000 to $100,000 ish range in award. Again, it's based off of your qualifying educational debt. Part-time service providers, which again is 16 hours of direct patient care per week out of a 45 for 45 weeks out of a 52-week period. Part-time providers also must commit to a minimum 3-year service obligation. About 4 or 5, maybe even 6 years ago now, a program similar to this called the Medicaid Primary Care Loan Repayment Program, they had part-time providers had to commit to a 5-year service obligation rather than a 3. But this program reworked that, so it is now, whether you're full-time or part-time, it is a 3-year service obligation. Part-time awardees can get up to 35% of their qualifying educational loans paid off, up to $25,000 per obligation year, meaning the most a part-time participant can get out of an initial service obligation is $75,000. So, with the Oregon Healthcare Provider Loan Repayment Program, unlike programs like the National Health Service Corps and Nurse Corps, we accept both site and provider applications year-round. Awards are made 4 times a year. We just had an application cycle close. I think it was July. It was June, end of June. The date escapes me off the top of my head, but it was something like June 29th. And when that happens, as soon as one cycle closes, another opens. And you can find all of our cycle close and open dates on our program's webpage. So highly encourage you to check that out. And the current, see, I'm too past Bill did future Bill, who is now present Bill, are really solid here. The current provider award cycle opens at noon or closes at noon on September 7th. And the next cycle after that opens September 8th and closes November 9th. So I would highly encourage providers to apply as early in the cycle as possible. I can't tell you how many folks wait until, we're going to get a big application push on September 6th. And that doesn't leave, usually when a provider submits an application, we don't have a whole lot of time when a provider submits an application, usually it's generally not complete. There are some things missing. It's usually loan documentation, or perhaps the provider's role is unclear at the practice site. There's these questions that can come up. So to allow us enough time to have some back and forth with the provider, we encourage folks to apply as early in the cycle as possible. And if you apply on September 6th, it's highly unlikely that there's going to be enough time for that back and forth to have a completed application by noon on September 7th. So if you're interested in applying, or if you have providers that are interested in applying, please encourage them to do so as soon as possible. Moving on. So now we're going to move on to the Oregon State Partnership Loan Repayment Program. And I'm going to speed this up a little bit because we are running a little not low on time, but we're running a little bit behind, mainly because of all my extra words that I've been using and the issue with the headset. So this program, though, I am so excited to make an announcement that is going to be going live here in like 2 hours on this program's webpage. So, Oregon State Partnership Loan Repayment Program, also known as SLRP. It is funded by the Health Services Resource Administration, also known as HRSA. Like I said before, they administer National Health Service Corps, Nurse Corps. They do a lot of really cool stuff. They provide us with the funds for SLRP, and we administer it on their behalf. And SLRP, for the longest time, we're talking about since the inception of SLRP back in like 2011 has relied, so the feds, HRSA, require matching funds. And the state of Oregon makes a significant contribution to provider incentive programs like the healthcare provider incentive program that we just talked about, and tax credits and all these other things. So they've got that going on. HRSA's got this going on. So to match funds that are required from SLRP, we've relied on awardee practice sites to provide us with those matching funds. And as of today, the SLRP program no longer requires matching funds, which is huge. So if you are a provider working at a SLRP approved practice site, or if you're an administrator who is at a SLRP approved practice site and you've been unable to participate in the program because your inability to match funds, that is no longer a barrier. Also, we used to have to collect a 10% administrative fee to operationalize this program, but HRSA has provided that 10% fee. So it is not only are practice sites no longer required to provide matching funds for SLRP awards, they do not need to chip in that 10% administrative fee. So right now, we're just announcing, this is the first time I'm announcing this publicly. So if you are, again, if you're at a site that has not participated because that practice site match was a barrier, please do consider participating now. Please make sure that your site applications are up to date if your providers are looking to apply. SLRP have a little bit different requirements and payouts of practice sites, which we'll go over here in just a second. The one big difference for providers right off the bat here is in exchange for SLRP funds, a provider must sign up for an initial 2-year service obligation for full-time providers and a 4-year service obligation for part-time providers. Once a provider has completed either their 2 or 4-year service obligation, a provider may apply to up to 2 1-year continuations. So no matter if you're full-time or part-time, once you've completed your initial service obligation, you can come back and reapply to the program for 2 1-year continuations. And you must complete that 1-year continuation and then come back and apply to a second 1-year continuation if you so choose. The eligible provider types are, a lot of them are the same for the healthcare provider. And you can see here that one of the provider types is registered nurses. It's been the case for a long time in SLRP. The one thing that I do have to point out here is all of these folks have to be, again, working at SLRP approved practice sites in primary care in an outpatient capacity. So as a registered nurse, you'd have to be working in an outpatient unit. And what I did want to touch on a little bit is with the healthcare provider loan repayment program, healthcare provider incentive loan repayment program, the program that we spoke about recently, we evaluate the list of providers that are in there on a really regular basis. So while RNs are not currently a provider type that is accepted through healthcare provider incentive loan repayment, that could change in the future. I can't promise anything, but again, we can update that based on the needs of the state and communities. So do check back, and if we do make any big changes, we will for sure make a big deal about that and make announcements on that. And this list of who qualifies or who is eligible to apply is also on the SLRP website or the SLRP web page. So if you go to the Oregon Office of Rural Health website, click on provider incentives, and then click on loan repayment, there is a tab for SLRP and it has this information. So SLRP, there's a lot of ands here. With the state program that we talked about before, there was a lot of ors. However, with the Oregon State Partnership Loan Repayment Program, this is a federal program. There is a little bit less leeway. Practice sites must be a nonprofit, must have a health professional shortage area score that is relevant to the provider type. So primary care has to have a primary care. And mental health providers have to have a mental health website. But unlike programs like the National Health Service Corps, Students to Service, XYZ, this program isn't really focused on how high the HPSA is. It simply, does it have a HPSA? So some folks are a little, are worried about going through the National Health Service Corps process because maybe their HPSAs are, 7, 8, 9, 10, which generally wouldn't be considered competitive for things like National Health Service Corps. This program simply requires that you have one and not that you have one at a certain level. You have to be providing outpatient care. Again, all of those provider types, outpatient, primary care. And the site has to have a sliding fee scale that that offers free or discounted services to people at or below 200% of the federal poverty level, and offers nominal fee charges or free of service charge to those at 100% of the federal poverty level. And a practice site cannot take assets into account when reviewing a patient for their sliding fee scale. So if you're a practice site and you're looking into things like how much equity does someone have in a home, do you own a car, do you have things that could be sold off to pay for your debt, or things to be seized, that won't work for the program. It has to be based solely off the patient's income when applying for the sliding fee scale. And that practice site must have a site application on file with the Oregon Office of Rural Health that is no more than 1 year old. So full-time providers, which again is that 32 hours of direct patient care, could receive up to 50% of their qualifying educational debt, up to a maximum of $25,000 per obligation year for a 2-year service obligation, meaning for those 2 years of service, the most someone could get is $50,000. And folks can receive up to 25% of their educational debt for a maximum of $12,500 per obligation year for initial 4-year obligation. So that amount, is spread out more. You do get, that 25% as opposed to 50, but you're that 20, $12,500, if you times that up, it equals basically that $25,000 per obligation year, just spread out over 4 years. And again, after, but then that 50%, once you come back for a continuation, that jumps up to 60% of your qualifying educational debt. So folks who come back get a little bit of a reward in higher payout and a shorter obligation term. Oregon Behavioral Health Loan Repayment Program. So this is a program that the Oregon Office of Rural Health managed for some time. And then the Behavioral Health Workforce Initiative, also known as BHWI, over at the Oregon Health Authority, got a lot of money from the Oregon legislature to transform behavioral in Oregon. And part of that, to have the most impact, it was decided that the behavioral health loan repayment program would transfer from the Oregon Office of Rural Health over to BHWI to make sure that it was a coordinated effort. That is they're a fantastic office over there that is doing really awesome work to increase access to behavioral health care. We've got their website up here. Highly encourage you to check them out. If you are a behavioral health provider and are looking to receive incentives, this is your primary stop to go. If you're at a SLRP approved practice site, you can apply to SLRP as a behavioral health provider. But that first program that we talked about, the Oregon Healthcare Provider Incentive Loan Repayment Program, if you noticed through all of those provider types, there weren't things like LCSWs, marriage and family therapists, professional counselors, and provider types like that. Those provider types have all been moved over to this behavioral health loan repayment program over at BHWI. And again, that was to maximize the impact that those funds provided by the legislature could make. So this is information that I have pulled from BHWI's website. As you can see, a lot of it mirrors the stuff that we spoken about in the last two programs. This is subject to change, and I'm no longer a subject matter behavioral health loan repayment program. So if you have questions, please check out their website. They've got some really great people working over there that'll get back. So competing service obligations. We talked about the Healthcare Provider Incentive Loan Repayment Program. We talked about the State Partnership Loan Repayment Program, also known as SLRP. And again, that program no longer requires matching fees. Another thing that I'd like to point out about SLRP, and this is very important, and something that I should have touched on just a couple of slides ago, is we're announcing this today, that SLRP no longer requires matching fees. We have to have, we're towards the end of this SLRP grant year. So we have to get provider applications in by August 16th, because we need to have providers under obligations for this pot of money that we're currently working with by the end of August. So right now is the best time to apply for SLRP. We have a fair amount of money and a relatively tight turnaround to get it out the door. So highly encourage providers to apply to that program as soon as possible and before the 16th of August. So let's say a provider enters into an obligation with SLRP, or enters into an obligation with the National Health Service Corps or the Healthcare Provider Incentive Loan Repayment Program. Those providers must complete that service obligation before they can apply to another one. You can apply to multiple loan repayment programs at once. You could apply to NHSC, SLRP, and the Healthcare Provider Incentive Loan Repayment Program all at the same time. But the very first program that you accept and sign with, that is the program that you are locked into until you've completed your service obligation. Once you've completed it, you can apply to all kinds of incentive programs and come back to the well to receive, to apply to receive more loan repayment dollars. But tax credits, insurance subsidies, and the Public Service Loan Forgiveness Program, those are not considered competing service obligations. So you could be in our programs, take advantage of tax credits, taking advantage of the insurance subsidy program, enrolled in Public Service Loan Forgiveness, and ultimately, hopefully graduate from all these programs with little or no debt. I'm going to touch very briefly on loan forgiveness programs. So that's why it's just really one slide here. It is, we've got PCLF and the Scholars for a Healthy Oregon Initiative. The Primary Care Loan Forgiveness Program is a multi-institutional program. and it pays for a good portion of a student's medical education debt at a qualifying institution in Oregon, and that's places like Comp Northwest, OHSU, Pacific University, Oregon State University. It pays for that medical education in exchange for a service obligation once that student graduates and becomes a provider. PCLF requires that students go to, I shouldn't really say students because now they're providers, requires that those former students, now providers, go to a rural practice site in primary care. Scholars for a Healthy Oregon Initiative, another program that pays for tuition and fees in advance for a service obligation once they graduate. That is an OHSU specific program, and that program allows for both rural and urban underserved. If a student wants to go urban, it must be in primary care. If they wish to go rural, it can be primary care or a specialty. And that site application that provide that healthcare administrators at a practice site fill out, not only can we qualify your site to have your providers apply to loan repayment, we also use that as a way to ensure that your practice site qualifies so that you can hire loan forgiveness students once they graduate. And speaking of loan forgiveness students and once they graduate and addressing workforce shortages, we just have, this is graduating year. People are completing their residencies. People are completing their doctor of nurse practice programs or PA programs, dental programs. We have a whole lot of students who just graduated who are looking for practice sites. So if you have openings, I'm going to kick it over to Trixie here in just a second, who's going to talk about our services. Do reach out to us, because every single year, right around from May all the way until October, we've got a batch of different providers who have an obligation to work at rural practice sites or work at urban underserved practice sites. So please reach out to us. We'd be happy to help you. Also, I'm going to just kind of put this slide up here because we're really running low on time. We have a medical malpractice insurance subsidy program, which providers can take advantage of. Information is on the web page. I'm also going to blow past this right quick. We do have tax credits, and again, a provider could absolutely be taking advantage of a tax credit and be participating in a loan repayment program. And with that, magic transition, I'm kicking it off to the wonderful Trixie Ortiz.
Thank you, Bill. Appreciate that. Hello, everybody. Once again, thank you for joining us. I am actually in Kansas City today. It is very hot and very humid. Myself and our director, Bob Dumeg, are here participating in the American Academy of Family Physicians National Conference. Today is the kickoff day. So he's running the booth right now while I'm here speaking to each of you. So we all know that healthcare professionals are very critical to the stability of our medical services that we are providing here in our rural and underserved areas. And really, if we think about it, across our entire state, recruiting and retaining hard-to-find healthcare professionals is one of the biggest challenges that we are facing today. We've seen that increase even more with COVID and the effects that we have had with COVID. One of the biggest areas that we support is employers like you. Our goal, my goal, is to try to find the ideal healthcare provider for your open positions for the long term, not the short term. I work with providers that are specifically looking for rural and underserved communities to practice in. And we also understand not necessarily the rural life is for everyone, and that lifestyle is just as important as a clinical match. And just to reiterate once again, our office is here to be a resource for you, where we believe rural Oregon is where opportunity knocks. Next slide, Bill. There we go. Ah, there you go. Thank you, Bill. Bill's managing the screen for me, and I really appreciate that. Another thing I wanted to point out is we are also a resource to primary care providers as well as students. I work with primary care providers and also students that are looking for opportunities here in Oregon. And when I have providers or students reach out to me, one of the things I really like to do is to speak with them to have a good understanding of what they're looking for, not only in the clinical setting, but also in their lifestyle setting as well, because those things are important. So on a twofold there, I work with employers like you, and then I also work on the backside with providers and students. So there's a number of technical services that my position provides to employers like you. Practice site assessment, assistance with practice profile development, assistance with developing a recruitment and retention plan. We can also help with facilitating the marketing of your current job opportunities. And we also provide, of course, referrals to health professionals that are looking for opportunities that you might have. So I'm going to kind of jump back again and just talk about some of the importance that I feel are related to these 6 different elements that I just talked about. Being strategic in our physician recruiting is very important. It allows us, our organization, to anticipate turnover. For example, we need to plan for retirements of our providers so that we have an understanding of when we will start to see turnovers happen, especially with retirements. We can identify the patient needs of our community and our service area. A lot of times, our service area tends to be bigger than the community your organization might be in. So it's very important that we consider that. Also, it's important to take a look at what the organization's goals are and what services you're trying to fill, either whether it's a new service line you're trying to bring in or it's filling those gaps. So we want to be proactive. We want to utilize data-driven recruiting plans, and we can begin that with implementing a community and practice needs assessment. And that is something that I can assist you with as well. Practice profile development. This is probably one of my biggest things that I like to work on when I have a site reach out to me and ask if I can help them redevelop the practice profile. When we are looking at sharing our opportunities, kind of have to take a step back and look at it differently when we're looking at it with healthcare providers. We don't want to just put out a job description. We all know what a job description looks like, and a lot of times our job descriptions entails a lot of different elements outside of what the clinical aspect of our job is. Utilizing a practice profile and unique selling points within your facility will help draw more attention to your opportunities, is how I feel. We almost have to put on a marketing hat. Actually, we do. When I work with sites on some of their practice profiles, I put on my marketing hat and really try to look at it as if I'm a marketer. You want to market your facility, your community, and your surrounding areas. And again, always ask yourself, why do I work here? And when I previously worked at a critical access hospital, was doing recruiting, a lot of times when I would talk to providers, I would talk about, why I worked here at that organization and what that was about and what I enjoyed and liked about that. And those are all important aspects that you can incorporate into your practice profile. We can also assist you with developing a recruitment and retention plan. That is very, very important for an organization to have in place. It is very critical, in my opinion. Recruiting top providers is expensive. We all know that, and it is very time-consuming process. And we want to make sure we're doing it as efficient and as effectively as we can. Another big thing that we do is we facilitate marketing of current job opportunities. And a lot of those, that marketing is based off of our organizations, our sites that are utilizing 3RNet. But what I want to say outside of our 3RNet members is we don't just market our 3RNet site opportunities as well. If you have an opportunity that maybe you're struggling with trying to fill through your own recruitment efforts, please reach out to me and let me know what it is you're working on, what you're trying to get out there more. And I'd be happy to share your opportunities through our social media outlets as well. We utilize LinkedIn, Twitter, Instagram, Facebook, and then we also on our website, those job opportunities end up getting into our newsfeed as well. We also facilitate the marketing of current job opportunities by promoting your opportunities through various in-state and national events. For example, I'm here in Kansas City this week at the American Academy of Family Physicians Conference. And so we're here talking about all the great opportunities that we have in our state. Also, we participate in local opportunities. This year alone, I have participated in 3 career fairs in the state of Oregon, and I've also participated in 2 community health fairs. And if you are putting on your own healthcare career event, or maybe you're sponsoring a community health fair event, reach out to our office, reach out to myself, and see if our office, is available to participate. And we would love to. I really enjoy doing that. I enjoy supporting our community and clinics on promoting the services and the opportunities that you have. And then another big piece is providing referrals of health professional candidates who has expressed an interest in job opportunities that match your facility. So obviously we are encouraging rural, underserved frontier opportunities. And when I have providers or students or residents that reach out to me looking for opportunities, I in turn then go back out to find those opportunities, search what's open, and share that information with those candidates. I like to call myself a connector. Think of me as someone that can help connect the provider with the organization and then vice versa. Next slide. Thank you, Bill. So another big piece of my position is 3RNet. 3RNet is full of mission-minded health professionals. 3RNet is considered the nation's most trusted resource for health professionals that are seeking careers in rural and underserved communities. I'm actually here in Kansas City this week, along with 3RNet. I'm a part of their network here promoting Oregon as well. One of the things that I've enjoyed myself working with 3RNet, not only in this role, but in a previous role when I was working for a critical access hospital, is those healthcare professionals that are registering on 3RNet, they already know and understand that the focus of 3RNet is the rural and underserved communities of our nation. And so it kind of breaks that small barrier already of the rural and underserved. Now, I don't want to say that we don't have health professionals that register that are also looking within the city, within Portland, within Salem as well. But they also know that it is definitely a rural, underserved focused platform. And so I like that. It helps break that barrier. By posting jobs on 3RNet, you gain access to tens of thousands of actively registered candidates. It is free for providers, health professionals to register on 3RNet. There is no cost. We do not make cold calls. And really every candidate has chosen to sign up with 3RNet. There are new health professionals that register every day, and there are job opportunities across our nation. 3RNet is powered by the National Rural Recruitment and Retention Network. And 3RNet is powered by network coordinators. That's what I'm considered. I'm considered a state coordinator. And I just wanted to state, I don't work for 3RNet, but the way 3RNet has structured is there's a representative in each state. Each state is represented on 3RNet. And that state coordinator is typically through either your primary care office or through your rural health office. And for the state of Oregon, it falls under the Office of Rural Health. Next slide, Bill. Oh, back one more, Bill. All right. Okay. Sorry, Bill. Next one. All right. There we go. Okay. I borrowed this recruit tension from 3RNet directly. Recruit tension is recruiting with a goal toward retention or recruit tension as a best practice and is one of the core beliefs of 3RNet education. Recruit tension is a term that was coined by one of 3RNet's previous executive directors. And really when we're recruiting, we have to remember that retention is tied right along with that. And I know sometimes we get stuck in the recruiting mind. I've got to hire, I've got to fill that position. And I know within myself in years past, sometimes that gets so focused, especially when you're administrative, your C-suite, your practice managers, they're feeling the pressure and the constraints of filling those opportunities. And so sometimes we can struggle with balancing recruitment with retention. And so what I encourage is when you look at your candidates and evaluate them, not only look at them as the immediate, but also on the long term, because we want to keep our health professionals for as long as we can. Now, the way 3RNet connects communities and health professional job seekers is one, we have the job seeker who registers on 3RNet. And as soon as they register me as the network coordinator, I get notified right away that I had somebody new registered and marked the state of Oregon as a place of interest. And then you as an employer that are utilizing 3RNet would also get notified right away. So it's almost a double, I don't want to say, it's almost like a double dipping. So my role when a new health professional registers on 3RNet, I automatically reach out and send them a personalized email. I share the opportunities that match their profession. And then I talk a little bit about some of the incentive programs and benefits of working here in the state of Oregon. And that way, not only are you as the employer, the recruiter, also getting their information and reaching out. I myself am also reaching out. And my goal in reaching out is to try to get them to engage with me so that way I can have a more personalized discussion with them on what they're looking for so that I can do the best that I can to match them to the right opportunity and the right employer and the right community. Next slide, Bill. All right, so this is some of the elements of 3RNet. Process and teamwork are key. I know as recruiters, especially if you're working in a smaller community hospital, sometimes you can feel like you're all alone and you're the only one trying to do it. But I just want you to know you are not alone in recruiting. There are a lot of resources that can help you. For example, our office, we can help you be more successful in recruiting and retaining employees. I'm so sorry. Recruitment is both a science and an art. So if recruitment was a science, you could follow a manual and everyone would succeed, right? And if recruitment was an art, there would be no best practice or guidelines to follow. So some of the most successful outcomes from those organizations that have the person recruiting is following a process and also adapting strategies depending on your circumstances that your organization is working on. I like to say that a well thought out plan will help you save time, stay within your budget, and direct you in hiring the right provider, health professional, and in the end will help you with retention. Those are our goals. Another thing that we all face, and we face it whether we are in an urban community or a rural community. And I know our rural communities face this at a stronger level because it is harder to attract, health professionals to our rural communities. But competition is fierce, you guys. We know that it's fierce. And so one of the things that I like to strongly share with those recruiters that I talk to, that I speak to, is communication. Communication is key when you are talking with a candidate. The beginning of that relationship that you have with them, that initial phone call, that initial email is going to set the stage for that relationship and will help set that stage on hopefully engaging that professional and wanting to learn more about your organization and opportunity. Remember, we have to look at the candidate specifically. I wanted this statement in here where it says, you might have the best wine in the world, but if the candidate doesn't need or want it, the result is really null. So that's when we take a more personalized look at the candidate we're speaking to. What are their needs and their interests, not only for themselves, but also for their family? Maybe, the health professional's wife is an avid ice hockey player or is very involved in music and those things. So try to capture those things that may attract that provider to your organization. And people and tools exist to help you to recruit more effectively. There are a lot of tools and resources that we can utilize that are not super costly. And so it's just, I think, us knowing and understanding what all of those resources are. And again, our office is one of those resources, and I strongly encourage you to reach out. Even with the smallest question that you might have, reach out and ask. And if I don't have the answer, we as a team always try to see if we can find the answer or get you directed into the right direction that you're looking for. Next slide, Bill. I apologize. I have a little bit of allergies going on. I thought it would go away while I'm here, but apparently not. So I wanted to share with you the Oregon 3RNet impact statement, and I ran it for the previous 12 months so that it captures the last 12 months basically. And so this is how they have it broken down for us. And this is something I'm happy to share with you as well if you're looking for this type of information on your own. But for the past 12 months, it just gives you an example of the views that our specific Oregon opportunities have received. So jobs posted, 335 jobs added or updated. We have 280 jobs active right now on 3RNet for Oregon. And one of the things I wanted to share, and I do get asked this quite a bit, especially when I'm working with a new site on 3RNet, can I post this kind of job? Can I post this kind of job? And you can post anywhere from a physician down to a dental hygienist. I see lab technicians on here, imaging technicians on here. 3RNet tends to be heavier in your primary care professionals, your advanced nurse professionals, physician assistants, but there are also other health professionals on there. And for the total of 12 months, we had 546,000 views, which I thought was really great as well. Let's see, what else? As you can see, also referrals through 3RNet, number of health professionals referred to employers. For example, we had over 29,000 referrals for that 12-month period. And I added 2 icons on here as well, because I think it's also important. I wanted to share this as well, because 3RNet is continually working on improving their services, their programs, and their outreach. And 2 big things they added on just a few months ago is health professionals that register now have access to 2 digital badges. The first digital badge is if they were an AHEC scholar, they can now add that to their profile. And then the second badge that they've added, which falls under the National Association of Rural Health Clinics, and that is a certified rural health clinic professional. Sorry, it took me a minute to state all that out. So those are 2 things that they've added as well. So you can find those providers on 3RNet with those badges. And one more piece I wanted to add as well is 3RNet has recently added a new tool. They call it 3RNet Tools, and it has a number of additional benefits if you decide to do the 3RNet Tools membership. But some of the things that it does is you can now link it to your website. They now are doing featured jobs with those sites that are utilizing 3RNet Tools. You can now track your providers through 3RNet. You can set up email templates all through that new 3RNet Tools. And I see a number of questions that are popping up in the chat regarding 3RNet. And I'll try to do my best to get those answered once I'm done with this. All right, Bill, next piece. And I'm going to wrap this up really, really fast, you guys, because we only got about 15 minutes left. And I want to make sure you have questions, that you guys can share questions and we can try to get those answered while we're on here. But my final thoughts is this. In recruiting, I think the biggest thing is our partnerships. We need to have partnerships, and those partnerships are kind of across the board. The Oregon Office of Rural Health, we are your partners. We want to work with you. Your AHEC, get involved with your AHEC program here in Oregon. It is such a critical piece, and our Oregon AHEC does a lot of work throughout the state. The Oregon Primary Care Association, they also have a job posting available on their website. So you could submit your opportunities through there. The Northwest Regional Primary Care Association, which obviously is for the entire Northwest, they have job postings available as well. Get connected with your Chamber of Commerce and your city council. Some of your biggest partners can be your community members, your mayor. Those individuals also have an invested interest in your healthcare organization, and involve them as much as you feel it's appropriate or needed in the recruitment process. Get involved with the Realtor Association, make connections with your realtors so that you have a good understanding of the housing market, because that's a critical piece. That's a big piece. I know that our organizations are struggling with. And same with daycare. That's another huge piece. I hear that a lot when I talk to sites. It's also connecting with your community child daycare centers. Be connected with your school district, especially when you're recruiting health professionals that have families. That's a big, important piece. Get involved with your community college, especially if they have a nursing program or medical assistant program. And then outside of all of those things, there are a number of other resources that you can utilize to help strengthen and overcome some of these challenges. And what I want to end is this. If I am already working with your organization, yay, I am so excited. I really enjoy working with each and every one of you. And if I'm not working with your organization, reach out to me. Let's set up a meeting. Let's talk about what you're working on, what you're struggling with, what you might need assistance with or not. Maybe you just have a few questions. I'd be happy to speak with you and talk about that, because I want to help as much as I can our rural communities sustain their healthcare workforce as well as grow their healthcare workforce. And thank you again for participating. Bill? And here, as you see, just a few other resources for you guys to access for your recruiting needs.
Thank you so very much, Trixie. It looks like that we've answered a majority of the questions through the chat. But if we didn't get to your question, please retype it. But we do have one from Deb out here for you, Trixie. I know this sometimes can be a little bit of a hard one to pin down, but Deb asks, can you tell me how many positions were filled via 3RNet in the past year?
Deb, I can get you that answer, and I hate to say it this way. I would need to run a report out of 3RNet, and then I can capture the number of those that were filled. I do want to state that we rely on our employers when they fill a position, whether it's through 3RNet or an outside source. When they close out that opportunity on 3RNet, they have an option that they can mark whether it was filled, with a 3RNet member, an outside source, or internally. And so sometimes we do struggle with our sites not clicking those, and so we sometimes miss that data. But Deb, I'd be happy to get that information for you outside of this session if you're okay with that.
Awesome. And it doesn't look like we have any any other unanswered questions, but we do have 10 minutes. So I'm just going to kind of wrap this all up. And if you all have some questions while I'm chatting away here, please do feel free to type them into the chat box, and then we will attempt to answer them. So kind of, the topic of this was addressing workforce shortages, and a lot of it is addressing it. Our presentation is addressing it through the services that we offer. And we realize that, these are all tools in a toolbox. There are other tools out there. And if you all have ideas for other things that are working for you, we are, part of what we do is collect and disseminate information, like I said before. So if you have things that are working for you or things that are not working for you, reach out to us. Not only do we have our workforce services team here, we also have a field services team between the 15 or so employees that work for the Office of Rural Health, we have an amazing knowledge pool here. And if we can help connect practice sites, connect providers, share ideas, it'll benefit everyone. So if you could please, hopefully you found this informational, but if you still have lingering questions, reach out. And also, I kind of wanted to just kind of encompass what we were talking about. We've got loan repayment programs that your providers can take advantage of. We've got loan forgiveness programs, so you have access to newly graduating medical students who are now going to be providers who have obligations to the state. You've got access to the wealth of knowledge that is Trixie Ortiz and the data that we provide also. The data that I spoke about before, Emerson Ong, who is our in-house data analyst, though that data really informs a lot more than just what happens in our office. A lot of people rely on that data, both on a federal and state level. So if you're looking for good data on workforce shortages and are interested in learning more about challenges in your area or surrounding communities, I highly encourage you to check that out. And I'm going to make two more plugs here at the very end because I think they're really important and near and dear to my heart. And one of them is that the Rural Health Conference, it's the 40th annual Rural Health Conference. It's our second year that we're going to be in person post-pandemic. We had, during the pandemic times, we had to do some virtual conferences, which went really well, but that really in-person bit and being able to connect and to talk, not only during the conference, but post-conference. Sun River Resort is a nice place and plenty of places to go sit and chat outside and inside, or little local restaurants for people to get together and talk. And really, I think that networking piece, beyond the great informational sessions that'll take place, is that networking piece. So I highly encourage you to check that out. And also, I'm going to beat the drum one last time for the Oregon State Partnership Loan Repayment Program, also known as SLRP, which no longer requires matching funds or administrative fees for the first time in its history. And we have a fair bucket of money and a short time to get that money out the door. So please, if you're not a SLRP approved site, consider becoming one. If you're not sure, reach out to us. I'm going to move my advanced slides here so you can reach out to either one of us, and we'd be happy to route your email to the appropriate person. There is no wrong door when reaching out to us. So if you've got out workforce or rural health clinics or the data that you find on the sites, feel free to just, we've got some general emails out there. But if those, if you can't find them or you just have these slides, you can always email us and that'll be, it looks like, Trixie. Yes, we will be sending out this presentation and slides for everyone who's not only here, but also we'll be posting this on our website and sending it out via our various social media channels. And we are now down to the last 5 minutes. We can, I think we can wrap this up, or we can sit in awkward silence for the next 5 minutes. We could just stare into the computer and make, people feel generally uncomfortable. We're not going to do that. We're going to go ahead and wrap this up. I've been Bill Funder and been co-presenting with the fabulous Trixie Ortiz. We're from the Oregon Office of Rural Health. I hope that you've learned something, and please, looks like Mike is looking forward to the Rural Health Conference. I'm looking forward to seeing you there, Mike. Please seek me out. Would love to chat with you about all things allied health and the future of SLRP and things like that. Again, if you have any questions at all, feel free to reach out to us. Have yourselves a good day. Thank you so much.
Thank you, everybody.